March is Colon Cancer Awareness Month, and according to the CDC, colon cancer is the second leading cause of cancer deaths in the U.S. That's among cancers that affect both men and women. So Dr. Sandosh Nandi, a colorectal surgeon at Swedish Medical Center, is joining me now to tell us more about this disease and to help raise awareness. So, Dr. Nandi, what causes colon cancer and how does it affect the body?
Well, what causes colon cancer are mutations in the cells lining the colon. And that leads to precancerous polyps, which then can lead to colon cancer. So we are really big about promoting screening for colon cancer in hopes of prevention.
Great. And last year, actor Chadwick Boseman, who was best known for the Black Panther, died at 43 from colon cancer. Of course, his death hit a lot of people and brought to attention to the racial disparities that colon cancer is more prevalent and deadlier for Black people. Do you know why that is and what can be done to close that gap?
His death did bring a lot of awareness, not just to the African American population, but the general population as well. The reasons that African Americans are at a higher rate for colon cancer, and it's pretty significant. They have a 20% more likelihood of getting colon cancer and a 40% more chance of passing away from colon cancer. It's multifactorial. There's socioeconomic reasons and as well as probably underlying genetic reasons as well. The biggest disparity always comes with screening and prevention. The earlier potential for detecting these things always leads to better rates of treatment and cure. And so some of the socioeconomic reasons result in, whether the African American population has lower healthcare availability, healthcare, guidance as far as getting those critical preventative maneuvers.
Interesting. And going off of that, everyone over 50 should get a baseline screening colonoscopy, but a lot of people find them to be a bit intimidating. So what advice do you have to ease their concerns and encourage people to do that?
So first off, I wanted to start with, the guidelines have actually changed with that over the recent years from the American Cancer Society. It is now suggested that everybody starts screening at age 45. And that's across the board. That number used to be 45 for only the African American population, but it's changed now for the general population. We start screening at age 45. Colonoscopy, nobody likes to talk about it, but everybody has it. It's not the funnest thing in the world, but at the end of the day, it's a life-saving procedure. And the one thing that we like to stress when we talk about colonoscopies is it's not for just finding your colon cancer. It is about prevention. When we do colonoscopies, we find these precancerous polyps and we can remove them. So again, there's a lot of other various tests that are out there. Most of them are good at helping to find your cancer, but the goal is actual prevention.
That's great information. And do you mind elaborating a little bit on the other options besides a colonoscopy?
Sure. There are currently there's stool type tests that look for genetic markers suggesting colon cancer. One is called the Cologuard test. There's another one called the FIT test. Those tests are, again, good for diagnosing your cancer, but they do have false negative rates. Essentially, the false negative rate is about 10% for colon cancer, and for detecting large colon polyps, it's almost about 40%. So they are good tests for somebody who can't get a colonoscopy or is just, for some reason, really averse from getting one. But really the gold standard is a screening colonoscopy.
Great. Is there anything we haven't touched on that you want the community to know or be thinking about with colon awareness? I think the biggest thing is communication. And it comes from the primary physician from the get-go. I mean, knowing that this is a real thing that's affecting our society across the board is important. It's the only cancer that has really gone up in the younger population. I mean, overall, we're winning the war against colon cancer, but the rates for people less than 50 are going up, and we don't actually have a good reason as to why that's happening, whether it's something environmental, something in our food, processed foods, those kind of things. So having that conversation early with your primary physician, knowing that, screening is important, and then getting that recommendation referral to start having your colonoscopies at the appropriate age. That's great information. Thank you so much, Dr. Nandi. We really appreciate your time and information today. No problem. Thank you.
Of course. And you can find more information and resources for colon cancer on cbsdenver.com. We'll be right back.